Good afternoon, dear friends. Natalia is with you on the channel Just a Doctor, where I share my personal experience and answer your questions. Today we will talk with you about how to properly start treatment of hypertension. The normal blood pressure for each of us is considered to be 120 by 80 millimeters of mercury. The numbers 139 by 89 millimeters of mercury inclusive are also within the normal range. You will not believe it, but according to statistics, only 70% of those who suffer from hypertension know about its existence. At the same time, less than half of them take antihypertensive drugs, and every fifth receives effective treatment. It is necessary to start treatment of hypertension first of all with a change in lifestyle. Give up smoking, try to normalize body weight. In addition, it is necessary to reduce the consumption of table salt to 5 grams per day, change the diet, while including foods rich in potassium and calcium, vegetables, fruits and cereals, as well as foods rich in magnesium. These are dairy products, millet, buckwheat, apricots and other products. Review your attitude to life, make every effort to minimize stressful situations, and devote at least 4 times a week to physical activity for 40 minutes a day. The indication for the start of antihypertensive therapy is a persistent increase in blood pressure to the figures of 140 by 90 millimeters of mercury and above. Which antihypertensive drug should be preferred at the beginning of treatment of hypertension? It was found that only 60% of patients with arterial hypertension of the first and second degree have a positive effect from taking only one antihypertensive drug. Besides, to achieve such an effect, doses exceeding the average value, and sometimes the maximum, are often required. This contributes to the development of various side effects, which in turn reduces the patient's desire for treatment and destroys the authority of the doctor. Given the initial level of blood pressure, the presence of complications and risk factors, it is advisable to start treatment of hypertension with low doses of combinations of 2 drugs with different mechanisms of action. As practice shows, combination therapy has more advantages. Firstly, the use of drugs with different mechanisms of action allows you to control blood pressure figures more effectively and in a shorter time. Secondly, with combination therapy, it is possible to prescribe low doses of drugs. At the same time, the probability of developing undesirable effects decreases. Third, fixed drug combinations are now widely available that allow prescribing 2 drugs in 1 tablet, which significantly increases patients' adherence to therapy. When choosing a hypotensive drug, it is very important to take into account a number of factors, in other words, to start treatment in each specific case individually. For example, for young patients with a high number of heart contractions, in other words, an increased cardiac output, it is better to start hypotensive therapy with beta blockers, for example Conquer. For most patients at the initial stage of treatment of hypertension, it is advisable to prescribe a combination of ACE inhibitors and a thiazide or thiazide-like diuretic. If you are intolerant to ACE inhibitors, the so-called prils, the most common side effect of their prolonged use is a dry cough. Drugs of this group are replaced by blockers of the renin-angiotensin system. An example of this group is losartan. At the same time, both are better prescribed in combination with thiazides or thiazide-like diuretics. It is very important to assess the safety of the prescribed treatment when choosing the optimal drug for lowering blood pressure, while taking into account the presence of concomitant diseases. For example, with bronchial asthma or intermittent chromate, such drugs as a group of beta blockers will be contraindicated. These are metoprolol, bisoprolol and others. The appointment of alpha blockers and their help is resorted to with pheochromocytoma and the initial stages of prostatic hyperplasia. The presence of angina in patients will be a contraindication. Many diuretics increase the level of uric acid in the body, so they will be contraindicated for gout. In other words, when prescribing drugs for the treatment of the initial stage of hypertension, it is necessary to take into account a number of factors. Therefore, in each specific case, it is better to seek help from your doctor, focusing his attention on the presence of all concomitant diseases, on the intolerance of a particular antihypertensive drug and the features of the course of hypertension itself. Subscribe and be healthy.